Um, you have to learn to educate the people around you for your own safety. You probably heard me say this before, but I'm saying it again for emphasis. I like to think of content like water and salt. If you take a grain of salt and throw inside water and taste it, it does not catch it. You don't taste the salt. Put the second grain, does don't taste the salt. Put the third grain, you don't taste the salt. When you put a spoonful of salt in the water, now you taste it. In fact, salt completely settles and you see it under. I don't know the number of videos that are uploaded on YouTube every day. I think it's in billions. That's the number of videos uploaded on YouTube. So we're having how many billion videos coming at you every day on YouTube? So most creators think when they say one thing more than once, it becomes repetitive. Nobody's even watching your content. Nobody's looking at what you're even doing. I like to think about it like that, you know, so that you allow yourself to be creative. If the idea you're getting is to say it 20 times, say it 20 times. It's a lot of content going at those your fans. Those people you call your fans. They're not waiting for you. They're not sitting in the house waiting for you to make a video. You know, they are hoping that when you make a video, of course, not just hope. They are going to be so well trained. It will bring the video to them. You know, but they want to see you 5 times a day. If possible, repeat the same thing. Most of these the biggest creators, some of the ones I respect, Gary Vee and Co. Those people are repeating themselves. Gary Vee has repeated himself over 500 times that I know, saying the same thing over and over, over and over, over and over. You know, so I don't mind repeating what I have said before about medical education. Anytime you watch a medical video, a video that has impacted you as a medical video, send it to your neighbor. You're not helping your neighbor, you're helping yourself. This video, what I'm about to say in this video will help you. Assuming you have a stroke or you develop sudden onset loss of consciousness, or sudden onset inability to use one side of your body, including the same side of your face. You know. So send to your siblings, send to your neighbors, send to if you don't have your neighbors' contacts, there's a way you can search. There's a way they set it up on social media where you can send things. You can even repost on your page, self, so that the people who view your page also can have a look at it. But the point is, let us educate as many people as possible. We're going to get. I'm not saying it will happen to you anyway, but if it happens to you, you want to fall into the hands of somebody who has information, so they move fast enough. A stroke is called a cerebrovascular accident. That word means it can happen to anybody. Accident means accident. You can pick anybody and happen to them. What are the chances that it will happen to you? I don't know. But you could have an accident. This cerebrovascular type. So you want to be able to have the best hands when you're unconscious, when you suddenly cannot talk, because that's what happens. The hands are knocked off, but the muscles that coordinate speech also can go. The center that coordinates speech also can go at the same time. So you can't even communicate to people and tell them what to do for you. They will move you and you're trying to talk and they will not listen to you because they think it's part of what's happening to you. They will not be trying to communicate, help me do this, help me get this. But when you educate them ahead of time, multiple times to where it stays, you can now safely be sick around them because you have people who are informed. So all the blood in the body exists inside a container, the heart. Think about it like a muscle bag that has blood in it. When it pumps, blood goes out through pipes, arteries. And then when it opens up, blood comes back to it through veins. Veins are the ones you can see. Arteries are the ones you can feel. When you touch here, you can feel pulsation. Touch here. Touch here. The same thing. So those things that are pulsating is fluid moving through pipes called arteries. They're moving out of the heart. So as it's beating, boom, boom. So as it's closing, it's pushing blood out. As it's opening up, it's bringing blood back through these veins you're seeing. All the blood in the body, all of it is inside the pipe. And it's sending blood everywhere. Blood picks up food and sends it around. Sugar. Blood picks up oxygen, sends it around. So blood is needed everywhere because important things are inside it that the entire body needs. This side of the brain controls this side of the body. This side of the brain controls this side of the body. And if one of the pipes that send blood to any side of the brain experiences a block or a breakage where blood is now leaking out, if that happens, blood cannot get to the where it was going to. So blood is on its way through a pipe to somewhere, and then there's a blockage. It won't get there. Or there's a breakage. It will just pour, to spill. It doesn't get there. So when that happens, the destination, which is the brain, where the blood was going to, you will not get blood supply again. And if that be the case, the person has now had an accident, a cerebrovascular accident, like I mentioned earlier. And what is to show as suddenly they can no longer use, sometimes they can't talk, sometimes the face, they want to smile, they smile to one side, because this side is paralyzed. They want to say something, it goes this way, because this side is gone. Sometimes it affects half of the voice box. It's gone as well. And what you should do in the first to less than 3 hours from when that thing happens is one thing. That to decide what to happen from that point where the person lost function till going forward. It's a non-contrast brain CT scan. You take the person by yourself, depending on where you are, what country you're watching me from, where you're watching me from. In certain place climes where things work, of course, the emergency unit knows what to do. But in other countries, you have to do the emergency unit yourself. You take that patient and go and get a non-contrast brain CT scan. This should be done before 3 hours. With the result of that scan, you go to hospital and that problem will be corrected. And function will come back to almost 100% because you moved on time. But if you allow time to pass and the blockage stays beyond 3 hours, 4 hours, 5 hours, now the place blood was going to is the brain. You know how vital the brain is. It does not receive blood supply for that long. What happens is there's an injury that will potentially turn to cell death. And even brain injury is not reversible. So the person will irreversibly, and then when you now finally eventually get the scan done, after you've taken time, gotten to the hospital, when you're in a queue, because there are other emergencies that they have to triage and find which one is more urgent. When they find you, they'll do a CT for you. By then, the brain has collected a particular amount of damage, and then when what should be done earlier is now eventually done, some function may return depending on a couple of other factors. So if you are the person who has this accident, you want the people who are around you to make this move sometime. That's why I said share this video. That's why I said it. So that you educate as many people as possible. You don't know where you find yourself and this happens. It's an accident that happens to anybody. Just like cancer. Cancer has pick up anybody. Of course there are risk factors. But there are people who have cancers that have done nothing wrong in their life. They've never taken alcohol, never smoked. They've done everything by the book and they still came down with cancer. So some of these health issues, you want to be able to reverse them when one of them hits you. But sometimes you don't deserve them. And all of it is hinged on knowledge. So please, that's the first thing you should do. By the time we get the scan result, it will show us whether it's a blockage or a breakage. So if it's a blockage, there's something we'll give in that short time that will dissolve the block. Usually, the things that block the vessel is a blood clot. The blood clot is that thing you see when you bleed out and blood dries. Blood should not dry inside the vessel. It should dry outside. But you see, it's a cerebrovascular accident. So accidentally, blood clotted inside and then caused a blockage. And something will give that will break that clot and blood will start flowing. You don't want the brain to suffer loss of blood for more than 3 hours. Now, if it's a breakage that has happened and blood can no longer go beyond the break because it's spilling out, automatically the body makes an attempt to heal that break. And just like when you injure yourself and then there's some clotting that happens that tries to heal the skin. So the same way, some things try to heal the break. And then if you don't know that it's a breakage that happened, you assume it's a blockage because you brought the patient to the doctor without a scan, and doctor now starts doing something clinically before they now attempt to arrange to get a scan because the patient is unstable. The doctor can give something to attempt to flush a blockage, and it's the same anti-clot drug they used to break clots. That's the same thing that will go and destroy a broken vessel that's healed. It's a clot that heals. So it goes and reopens the vessel and bleeding starts afresh. So the body is already healing itself, and then the doctor creates another problem because everything he's doing blindly. Can you see? And they can excuse himself and say the patient is unstable. You know, your imaging, before you move somebody to that image, you want to be sure the person can at least live for 5 minutes, 10 minutes outside support. Assuming the person is connected to a support. You see, you know. So please, when you see my videos that teach medicine, send the videos around. Don't watch it, especially when you benefited from them. I'm not begging you to send my videos and share. If you felt something when you listen to me talk, then send to the next person. They probably feel something. If you get everybody around yourself, you will not forget to send it to them. You know, let's all get enlightened. You should be your first doctor. Doctors are usually very busy. You see, when you go to any hospital, you find out that the doctor patient ratio is so, is the balance like this. How many patients to one doctor? You know, and you're sitting in a queue waiting for his knowledge. Now you're getting knowledge free. You know, so you want to be able to take as much of it as you can, and then share it as many people as you can for your own safety. You know, immunization, we call it herd immunity inside crowd. So you may not take the vaccine because you don't like what the vaccine is about. But when the people around you is vaccinated, you're automatically vaccinated because they cannot get the infection and they're the ones around you. So the infection cannot cross them and come because they can't get it. So they can't. So you are in the middle. You see, so you're immunized just by being in the middle of people who are immunized, and even though you're not immunized, I see. So the same way, when you surround yourself with knowledge like that, you're safe. So it's not about having knowledge all by yourself. It's about educating everybody around you as much as you can so that you're safe.